I don't know if you know about her. She's the most influencing singer in Korea recently. In general, to achieve beautification in Asian patients, I focus mainly on the volumizing of the center of the face. Because most Asian women have lateral projection of the face due to high cheekbones and central concavity of their faces. The effect of giving volume to the center of the face is that lateral projection looks less pronounced. As a result, the face looks a little smaller. Even if patients are young, many Asians have central concavity of their faces due to hypoplasia of the maxilla, the bone. These are most common bony depressions, and the area just next to the ala is called Ristoff space, which is the fusion of two fossa. I usually inject in this area when I want to correct nasolabial fold, especially for young patients. From the lateral view, I consider the criteria of Ricketts line, but I don't think it's necessary to follow them too strictly. I'm applying a more alleviated standard of Ricketts line for Asian patients. For example, if the ordinary Ricketts lines guideline is lower lip should be located 2 millimeters behind the line, but for Asian patients, the tip of the lower lip does not have to be behind the line, and it's fine as long as it does not cross the line. The concept of the diamond zone is to volumize these 4 points so as to create a more 3D facial contour with younger and more vivid look. For Caucasian, the shape of the diamond should be a little wider than that of Asians. That's why most Caucasians want lateral projections rather than central volumization. However, for Asians, as they have already lateral projection, we should focus on central volumization rather than lateral projection. Now let's have a look at characteristics of Cleviel filler, the premium HA filler made from pharma research product. I'll talk mainly about Cleviel contour, which is the hardest one with highest concentration of HA. Cleviel filler has a much higher concentration of HA compared to other regular HA fillers. As you see here, Cleviel contour has a concentration of 50 milligram of HA. Cleviel filler is made by 4L cross-linking technology. 4L means low BDDE used and manufactured under lower temperature conditions and low incidence of swelling or any allergic reactions. And it has a long duration. So Cleviel filler has quite enough longevity, and also it has a very high safety profile. The size of particles from Cleviel contour is quite smaller than other volumizer. And also the distribution of particles is homogeneous. As a result, Cleviel contour has a high concentration of HA. So particle size is very small, so it has low stimulation of adjacent tissues, so it has very less inflammation or any delayed immunologic reactions. The cross-linking rate for Cleviel is very low, less than 1%. Eventually, Cleviel could have a better safety profile. Cleviel filler has a long, strong lifting capacity. That is, it has high elasticity and cohesiveness. Cohesiveness means the affinity between the molecules or particles of the gel to stick together like honey. So the sand usually has a low cohesiveness or no cohesiveness, but some substance which is sticky usually has a high cohesiveness. Elasticity represents the ability to come back to its initial shape after mechanical stress, like earplugs. So if we push the earplug, it changes its initial shape. However, after a few minutes, after a few seconds, the initial shape usually comes back. So Cleviel filler has high elasticity and also high cohesiveness. I think these two rheological properties are very important for contouring HA filler. Here are the summarized advantages of Cleviel filler. It has a strong lifting capacity due to well-balanced rheological properties, and it has high ability to maintain its initial shape. So it means clinically it's very meaningful because after injection of cheek, for example, as we during sleeping at night, usually we move our face, and sometimes we can push a mechanical stress to the injection site, and then the filler shape could change. But if the filler has a high cohesiveness, this changing of the shape is quite less. And as it's very hard and it has a strong elasticity, usually we need less product amount. So if I use, in general, 1 ml of HA filler using other HA filler, if I use Cleviel contour, I usually use even half or 70% only. But I can achieve the same projecting capacity or projection of the tissue. And it lasts long, but it has a very high safety profile. And since it's very hard and it has very strong lifting capacity, I mostly use for correcting very difficult cases like hump nose, hook nose, or crook nose. I will talk about it later in detail. Clinically, best results can be achieved when Cleviel is injected in the following areas: nose, nasal tip, and anterior medial cheek, wrist of space, and also columella and chin, where these are where we want to project the tissue. It's usually the central part of the face. From the frontal view, these parts belong to diamond zone as a facial contouring concept, which is very useful guideline using filler injection, especially for Asian women. Let's have a look at the injection technique in each area. First, let's have a look at nasal augmentation technique. When injecting the filler to augment the nose, the first evaluation before injection should be the shape of the nose. So we should see about the patient's nose very carefully. These shapes are red circles. With red circles are worth the filler injection, which means relatively easy to correct using HA filler. However, other shapes may be difficult to achieve good outcomes. These three types of nose. Compared to surgical correction, the effect of filler injection is bound to be limited. So we cannot create the same result as a surgical correction. So certain nose shapes can be difficult to correct with fillers. So I'm not mentioning that we should not inject to correct this kind of nose. I'm just saying that we should lessen the expectations of our patients before injection. But I know that the filler injections result can be limited compared to the surgical correction. However, it can provide a natural and very smooth results, and also almost no downtime compared to the surgical correction. So in Korea, many patients are switching to filler injection from the surgical correction. Okay, let's move on to the next slide. There are some preset angles and lengths that can be guide on the standard for ideal profiles of the nose. I will introduce some of them which are useful when injecting the filler. These are ideal angles of nasofrontal angle and nasolabial angle, which are different according to men and women. For example, the nasolabial angle should be a little wider for women than men. We do not have to follow them strictly, but it's better to refer as a guide before planning the nasal injection. Also, we should consider about a continuous curve from the eyebrow to the nasal line, because sometimes we can see a disruption of this curve by unwanted shadow after filler injection that makes natural and awkward result. So after injecting on the nasal ridge, we should consider of this continuous line. So sometimes we should inject a little small filler to connect the disrupted line. However, this area is quite risky area, so you should be very careful in injecting in the glabella area. So she was my patient, and I injected the Cleviel contour here, and I made a smooth continuous line. This line we call brow tip aesthetic line. Okay, we can make an obvious improvement by filler injection, improvement of profile on the midline of the face. So you see her rickets line was not appropriate before injection. So after injecting these areas, usually it's around the midline, along the midline. After injecting the filler injection, HA filler, Cleviel contour, we can make a better profile without surgical correction. These are the definitions of each part of the nose. Renion means the junction of the bone and the cartilage. So this is here. Just there's a bone just below the bony part. The bottom usually is softer than the bony part. So this transition zone we call renion. And infratip lobule here is the point where a cannula is usually inserted to fill the nasal ridge. The nose can be divided into bony part and cartilage part. The hardness of the cartilage is clinically important. If the cartilage is hard enough, it means the bottom is very hard. Then you can augment the tip of the nose easily. However, if the cartilage is too soft or too smooth, then you may think that the supratip elevation will not be easy. So you should predict about the result by touching the cartilage. The most important vascular structure of the midface is the facial artery. So always we are focusing on this artery because most of the accidents usually occur within this artery. So we always should memorize the running course of this artery, and we should always remind about this vascular anatomy. Okay, but it has many variations. So even if we are perfectly aware of this vascular running course, we should be also very careful because there could be some variations. So it depends on patient's age or ethnic differences. So here we have a facial artery, and after a bifurcation of superior labial artery, the facial artery's name will be changed by angular artery. So angular artery usually runs heading to the medial canthus, just next to the nose, and it has connection to the branches from internal carotid artery. So that's why injecting into this artery around here, the filler can go to the internal carotid artery, and it can obstruct the retinal artery. As a result, a blindness can occur. So we should be very careful when injecting around this area. When injecting a filler for nasal augmentation, I mostly use a cannula for safety reasons. However, when it comes to a hook nose, like this figure, I prefer to use both a cannula and needle together. The cannula for the cartilage part and the needle for the bony part. Because if I want to fill HA filler, Cleviel contour, whole through the nasal ridge, I already mentioned that I should approach to the infratip lobule, but it's quite difficult to keep the same plane passing this curved base. So using the cannula, I can fill this area, and using a sharp needle, and I fill this area separately, because this part I should not inject any filler. So depending on the nasal shape, sometimes we need to use a needle, sharp needle, but mostly I use a cannula. This is what I explained. So if the bone is protruded, it's quite difficult to inject deep layer by using a blunt cannula from infratip lobule. So for here, we should inject separately. Usually the needle is most available. Okay, so when should I use, or I mostly use a sharp needle. I have some exceptions. So these conditions, I should use a sharp needle. For example, a partial correction of the nose, like hump, deviation, or patient's nose has asymmetry. And if I want to inject into multi-layer, then I should use a sharp needle. And also, if I want a very superficial correction or scar correction on the nose, then I should inject very superficially using a sharp needle. And if a patient want a touch-up, so it's the same reason as the partial correction. So sometimes we should use, or it's better to use a sharp needle rather than blunt cannula. So we should know about when a sharp needle is preferable. Sometimes I inject into multiple layers. When injecting into a very complicated case, deviated nose or very severe hook nose, I should inject into not only deep, but also into superficial layer. But you should know that using Cleviel contour, injecting into superficial layer is not good. So when you want to inject into very superficial layer, use another very soft filler. You can use both in combinations. Sometimes I use 2-layer injection. Okay, if the nasal tip is facing down like this, and the nasal labial angle is too narrow, in Korea, we used to say arrow nose. So that means nasal tip is facing downward and the nasal labial angle very narrow. So for correcting this kind of nose, it's limited when we inject only into the supratip area. So it's better to inject to that area. I call anterior nasal spine injection or columella injection. If we inject filler into deep layer here, then we can achieve a better nasolabial angle, or we can widen the angle. So as a result, the patient's nose will look more, will have a better contour. But I sometimes use by a sharp needle perpendicularly to the skin. If you inject about 1 centimeter, you can touch the nasal spine here by your sharp needle. And then you only have to inject without pulling the needle about 0.5, sometimes 0.7. It's quite a large amount because this area has very loose connective tissue. So injecting very small volume will not provide any effect. So you should inject at least 0.5. I'll show you on my video demonstration. Or you can also use the cannula from the same entry point. But I prefer to use a sharp needle, but I will show you both technique on my video. Or combining thick, short pedio threads insertion along the columella, like this figure, can also provide a strong support to the columella so that you can elevate the tip of the nose more effectively and more easily. Pedio threads can also be used to create a more defined nasal ridge. So whether we can use for elevation of the nasal tip, so we should insert the thread to this plane. For nasal tip elevation, I usually use a very short pedio needle, which is quite thick. But when I use for nasal ridge rift or nasal ridge definition, I use a long PDO threads, but less thicker than this one. So it cannot replace the filler's effect. It can provide some better effect compared to using filler alone. So we should use both, not only the PDO threads. So this is my case, who was corrected by using Cleviel contour and PDO threads in combination. You see the nasal tip is much elevated. Sometimes maybe I can achieve by only filler injection, but in general, it's very difficult to keep this shape for a long time by using only filler injection. So for very short columella, it's better to use PDO threads in combination with filler injection. And also, botulinum toxin injection is important to achieve better results by relaxing muscles which are involved in shaping the nose. For example, if the tip of the nose is facing downward and a patient's nose is very hooked, then injecting these 3 areas, 2 to 3 international unit of botulinum toxin, will help to elevate the tip. Or if the patient's nose has a wide alar base, if injecting into the alar margin, just 1 to 2 unit only for one side, then the wideness will a little improved. Now let's have a look at the mid face, the nasolabial fold and intermedial cheeks. I think these 2 areas are most commonly performed area when I use HA filler injection. As we know, there are 2 types of subcutaneous fat compartments in the face, deep and superficial. Usually for contouring the mid face, the target layer for filler injection should be the deep fat compartment. However, recently I sometimes inject into the superficial fat layer, occasionally if necessary. So there's no absolute rule, but in general, it's better to inject into deep layer when we want to contour the mid face. These are precise definitions of mid-facial grooves and folds that are known as aging signs. So as we age, there will be a tear trough and sometimes palpebral malar groove, but usually for Asians, tear troughs are more definite and more obvious than palpebral malar groove. So most cases are necessary for this tear trough correction. And also there is mid-cheek groove or Indian bands. So the exact expression word is mid-cheek groove. And also we have a nasolabial fold. So we should be aware of these names to communicate with other doctors. And when injecting the filler for the mid-face, this ala tragus line is frequently used as a landmark and is quite useful when planning the mid-face injection. It is also called malar equator because it divides the upper and lower face. So this is the division line between upper and lower face. And it also corresponds with the course of the zygomatico-cutaneous ligament, which is the cause of the Indian band. So this is the retaining ligament. It's almost on the same line of this malar equator. And upper part of this allatragus line, usually there is a bone at the bottom, so you can use either cannula or sharp needle. Sharp needle using vertical bolus injection, because you can touch the bone with your sharp needle. However, lower part of this line, there is an oral cavity inside. I think you are more professional than me about this oral cavity. So there will be no bone at the bottom. So it's quite difficult to use a sharp needle or vertical injection. So mostly we use blunt cannula using horizontal injection. And mostly I use fanning technique. So there's a little difference between two parts in terms of injection method. And so this line has many clinical meanings, so you should be aware of this line, and using this line, you will be more, you can perform a more constant and very precise injection technique. So when injecting into anteromedial cheeks, as I already mentioned, for Asians, the central volumization is more important than lateral part. So this part is quite commonly injected area, especially in Korea. I usually use two imaginary lines, which are one line from lateral canthus to mouth corner and allatragus line. The crossing point will be the optimal injecting point, but it's only the reference. So you can inject a little different area. It's up to you. But this is just a guideline, so it's better to refer. So this crossing point will be the best entry point. But vertical bolus injection, yes, but not 90 degree, about 70 degree, heading a little to medial. But you should be very careful because there is a infraorbital foramen 1 centimeters below the inferior orbital rim, but a little medially, it is located a little medially. So injecting a little lateral part, there's no risk. So I use sometimes a sharp needle because I can save the product. I can inject more efficiently when I use a sharp needle. But if you don't want any bruising or any risk, then it's better to use a blunt cannula. Anyways, if I use a sharp needle, I mostly inject into the deep area. So I touch the bone with my sharp needle and I inject on average 0.3 to 0.5 ml per side. And injecting points are maybe 2 or 3, sometimes 4. It depends on the patient's condition. And not only injecting here, but you also you should also consider about injecting the tear trough and nasolabial fold, because if a patient has depression of these 3 areas, and if you correct only this part, the cheek part, then the tear trough and nasolabial fold would look severe or worse after injection, and the patient will complain about, doctor, after your injection, after your treatment, my friends told me that my nasolabial fold or tear trough look worse. So it's better to correct this area together, or if the patient don't want to inject this area, you should at least mention about these possibilities after injection. And when it's a blunt cannula. Anyway, if I use a blunt cannula, the entry point will be a little lateral part from compared to when I use a sharp needle. So I use 2 different lines. the vertical lines passing from the lateral canthus, and not a la tragus line. It is a la earlobe line, a little more horizontal line. So the entry point will be the crossing point. So it's more lateral. So I can, usually I use 5 centimeters long. I prefer 22 gauge cannula, but you can also use 23 or 21. It's up to you. So it's quite rigid and thick because you should penetrate the SMAS. So you should inject below the SMAS area. So a very thin cannula is so flexible, so it's very difficult to reach into the deep layer. And the injection amount will be a little larger than in case of using a sharp needle. Sometimes almost similar. And also, tear trough and nasolabial fold should be considered before injection. And this is nasolabial fold. In order to effectively correct the nasolabial folds, the cause of the fold needs to be identified because there are not only one etiology. There are 3 or more theories about the etiology of nasolabial folds. First, volumetric theory. That means there will be a volume loss as we age in deep medial cheek fat pad, and the maxilla will be depressed by bone resorption. So there will be a depression from the deep part. And another theory is a ptosis of the nasolabial fat pad. It's more superficial change. This superficial nasolabial fat will be migrated downward as we age, so the fold may look worse. And the last theory is muscular theory. There are few muscles that are elevating this part from the bone to the skin. So this part will be pulled up by the action of these muscles. So the nasolabial fold would look worse. So we should consider all of the 3 theories. So volumetric theory can be corrected by filler injection. However, gravitational theory cannot be corrected effectively by only filler injection. So we should consider about lifting, thread lifting, or any energy-based devices. And muscular theory, we will need botulinum toxin if necessary. So by only one modality of treatment cannot provide better result for nasolabial folds. When correcting nasolabial fold, especially in Asians, young Asians, we should always consider injecting the filler into wrist off space. I already mentioned about it. To inject into the proper layer, in general, using a long, sharp needle, usually 23 gauge, 1-inch length needle, is more convenient than a cannula. And the needle should be addressed perpendicularly to the skin, this area. This point is around 0.5 centimeters apart from this allofacial groove. So you should not go far from 1 centimeter. So the injection point should be within 1 centimeter from this groove along the nasolabial fold. But the needle should be inserted very perpendicularly, not angled. And you should touch the bone with your needle. The depth is variable depending on patients. Anyway, that's why we should use 1-inch needle. Sometimes the depth is around 0.8 inches. So with short needle, you cannot reach to the bone. And the needle should be addressed perpendicular to the skin. And after touching the bone, you should not move your needle and just inject without pulling back your needle. About 0.5 ml on average. Sometimes I inject up to 0.7, but don't inject more than 1 ml per side, because if you inject too much, the filler will migrate upward. So the depression will not be corrected effectively. Nasolabial full injection technique by using a needle. This is what I just mentioned. So vertical bolus injection for correcting the width of space. You should remind that this technique is more available, more preferable when you correct a young Asian women, not only Asian, but young women. However, if the patient's age is, patient is old, usually there will be skin laxity and there will be a superficial fold together, not only the depression. So you should also inject into the superficial layer. For this correction, I always use cannula because the facial artery or angular artery runs very close to the skin. So when injecting just below the skin or subdermal area, do never use a sharp needle because it's very, very dangerous. So deep to the bone, sharp needle is okay, no problem. Maybe there could be some hematoma or bleeding, but it's not serious. But if you inject into superficial layer, do not use a sharp needle. And for this layer, I use a little softer filler, but for the deep plane, I use contour. Contour is a very perfect material for injecting into deep layer. But for superficial layer, if you do not have Cleviel Prime, you should use other little softer product that you have. And I usually enter from the 1 to 1.5 centimeters laterally from the mouse corner. A little upper area is more easy to approach, and to prevent migration of the filler, I usually make the entry point a little upper than this one. And do not inject below from this line. This line is the mid point of the nasolabial fold. So inject only the upper part only. And when injecting superficially, do not inject a large volume and inject very slowly and use a blunt cannula. Usually I inject 0.3 to 0.5. So when I inject into 2 layers, deep and superficial together, I inject 0.5 into the deep layer and 0.3 for the superficial layer. So it will be 0.8 for one side. So I will use 1.6 in total for nasolabial correction. So mostly I use between 1 ml to 2 ml. Almost all cases are corrected by using this amount of filler. Okay, the last area of the diamond zone is the chin. The chin is also very commonly performed area. First of all, for female patients, the filler should not be injected beyond these 2 lines. So you should inject the filler within these 2 lines. If you inject beyond this line, you will create a more angled chin or a more masculine chin. So the patient will complain about it. So inject only within these 2 lines. And if the chin is little blunt and you want to give a slight volume, a slight point of projection by injecting a small amount of filler, it is more effective to inject the filler using a sharp needle. First, I inject the first point. I approach from the inferior part because this area, there's less vascular structures, so there will be less bruising than approaching from the front. But usually by injecting only one point is not enough. So you should inject 2 more small points than the first point, because I want to make a smooth contour, not a disrupted contour. And if you want a little more anterior projection, then sometimes I add 1 more point for anterior projection. But I use less than 1 ml for these 4 points. However, if the patient's chin is too retracted or the chin is very small, then a blood cannula is more useful, because in most cases I inject more than 1 ml, up to 2 ml. So the injection amount is larger. So a cannula is more convenient. And I inject not only into deep layer, but also into the superficial layer. So I inject into multiple layers because I want to make a smooth contour with a dome shape like this, not a projection. So for tower projection or pinpoint projection, needle injection is more convenient, effective. But if you want a smooth dome-shaped chin, then a blunt cannula is more convenient, and you should use quite a large amount of filler. Sometimes I use 2 ml. And for symmetrical injection, it's better to approach both sides, from both sides, not only one side. And if after injection, if the boundary line has a sulcus, we call pre-jowl sulcus, is more obvious after injection, then you should inject a little small amount for both sides to make a smooth contour. And gentle molding is also very important. Chin augmentation is almost always combined with botulinum toxin to relax the mentalis muscle. Botulinum toxin not only smooth the surface of the chin, but also prevent the injected filler from being squeezed or shape deformation because of the muscle action. However, inaccurate injections of botulinum toxin can cause a quite serious problem, which is asymmetrical smile, like these photos. It's quite frequently happening, in Korea also. So we should always very careful when injecting botulinum toxin into the mentalis muscle, because this side effect came from the diffusion of botulinum toxin into the DLI. So if the DLI is paralyzed, only one side will act or contract, and then this serious problem can happen. Of course, after 3 months, it will be normalized, but during 3 months, the patient will suffer from this unnatural look. So there's a rule. I will show you this rule. If you remind this rule, you will never do any mistake when injecting mentalis muscle. So this is the rule. This is intercilium line, the line which connect both mouth corners. And there is a line, horizontal line, which meet the apex of the chin. So 2 cm below this line, another parallel line will be the line A. And the line between the midline, between line A and this chin apex line will be the line B. And the gray line is the midline of the face. And from the midline, you move 0.5 centimeters from the midline, and which meets this intermediate line, B. that point will be the most appropriate injection point. So if you are expert, you don't have to draw these lines, but if you are beginners, please use this method not to avoid any side effect. And inject only 3 to 4. I prefer to inject 3 units per side. And the depth will be about 0.5 centimeters. So it's easy to memorize. And also DAO is most commonly injected area to uplift mouth corners or to reduce the Marian lines. This is the rule, the parallel line to the jawline, and within 1.5 centimeters, there will be a 3 cube rectangle. And the third one will be the most appropriate area to reduce the DAO's action and inject very superficially, about 0.3 centimeters depth, and inject the same amount as the mentalis muscle. And the jawline is also frequently injected area to make a more defined jawline or to reduce the platysma. It's quite a useful method. For this area, I use almost always 16 international units for both areas, so 8 units per side. And you should inject intradermally. It's very superficial and multiple points along the line, jawline. And these 3 areas are very effective when you want to make lower face very smoother and you want to make a more definition of jawline. Then this botulinum toxin injection technique will be very useful. Okay, a young lady, I will show you a case, had depressions in her mid-face. She was early 20s, quite young lady, but she looks old because she has very depressed mid-face and she looks sad. After restoring an optimal volume on these areas, which is a diamond zone, and now she has a more vivid look, and also her low face looks more lifted after injecting the mid face by a lifting effect of the SMAS. So you can also create a lifting effect by filler injection. Okay, I'm going to show you a short video about the nose injection technique using Cleviel contour. The most commonly used technique. I'm using 22 gauge cannula using Cleviel contour, and this is infralobule area, infratip lobule, and you can advance up to the radix using a short cannula. Sometimes if the nose is quite long, you cannot reach up to the radix, then you should add 1 or 2 points by using a sharp needle. So during injection, you should keep injecting very symmetrically. So using your other hand, you see my left hand is quite busy to mold simultaneously during injection. And usually for bony part, I inject very small volume or no volume. I only inject in the radix and the supratip area, and also the tip, nasal tip area. So you can take your time, because there will be no bleeding when using cannula. It's quite safe. And I usually focus on the supratip area, because this part is a cartilage part, and usually most Asians have depression here. And then you see, using the same entry point, I'm reaching the anterior nasal spine. It's quite deep, about 2 centimeters, and inject a bolus, and keep pinch the skin using your left hand, to make a room for the filler location. And after injection, a small, gentle massage. You can use ointment, not to damage the skin. You should remember that, okay, you see, this angle is quite widened now than before injection. So you can create a more definite elevation of the patient's nasal tip. And you see, I'm adding a small amount of filler, 0.1, by using a needle. It's not dangerous if only you touch the bone during injection, because into the deep layer, there will be no vascular structures. Okay, so I'll show you the final result. Okay, sorry, because I want to show you something. Okay, what I want to show was that it's very important to keep the continuity of the nasal ridge or the dosum of the nose, because if the line is deviated or asymmetry, the final result is not good. So you should consider about the sharp lines and very constant lines without any deviations. Okay, this time I will show you the anterior middle cheek injection by using a blunt cannula. This is the entry point, and I can reach to the tear trough, but sometimes tear trough cannot be corrected by blunt cannula from this point. So I should add some more points. This is the wrist of space injection. I'm using 23 gauge 1-inch cannula, and after aspiration, I inject 0.5. Inject very slowly, because if you inject too rapidly, patient will suffer from the sharp pain. And I'm adding some points to make a smooth contour. So it's just making less boundary lines visible to make more natural result. You should add some more points by using a sharp needle. And same procedure for left side. This area is 0.5 centimeters from the alofacial groove and almost vertical. And when injecting into the nasolabial, the tear trough, you should pinch the skin, not to migrate, not to prevent filler migration. And for the nose, she already has a good nasal tip, so I only inject it into the radix. So injecting only into the radix, then a sharp needle will be more convenient. Maybe 2 points are not enough, then you should inject 1 more point. There could be some bleeding, but it's quite safe technique. And also only nasal tip elevation, and a sharp needle will be enough, but convenient. But you should use only small volume, 0.2 or less. Don't inject more than 0.2 for nasal tip injection, because it will cause some compression of the tissue, and nasal skin necrosis may happen. For the chin, as she has already good chin, I injected a small volume for using a sharp needle, only 3 points, to make a more anteriorly projection. I'm always pinching the skin to make sure that I'm injecting into a very precise location. This is a botulinum toxin for glabella wrinkles. I usually inject 3 to 5 points using 12 to 16 units. And this is for reducing nasolabial fold. She's young, so she doesn't have any line or fold. It was just depression, so I injected only into the deep plane. And botulinum toxin, 2 units. And I injected 2 points of botulinum toxin to reduce the mentalis muscle. Okay, maybe I have 5 minutes for the rest of my lecture, less than 5 minutes, so I'll finish within 3 minutes. Another concept that I want to introduce you is the V-zone contouring. Because temple augmentation is also a good suitable indication for Cleviel contour. So if we put this indication, then we can create another concept, which is facial V-zone. So there is a diamond zone and V-zone. You can choose one of both methods depending on patient's needs or your decision. You can use both concept or plan because it's quite useful for Asian women. And this V-zone contouring can also provide facial lifting effect. When injecting into the temple, again, anatomical structures are very important. You should be very careful of the superficial temporal artery. You can touch the pulsation. And also, the branch of the STA is frontal branch. And just below the STA, there is a temporal branch of facial nerve. And also, one more structure is middle temporal vein, which lies parallel to the zygomatic arch, 2 centimeters above the upper border of zygomatic arch. But it runs into a deep layer. So this area, do not use a sharp needle. But however, this upper part, you can use a sharp needle. So like the nasolabial fold, we can use 2 layers. The one is a deep layer using a sharp needle, 1-inch sharp needle, like the wrist of space. You can inject touching the bone, very deep space. Sometimes I inject 1 ml per side. For young women, only deep injection may be enough. But for old women or the patients have very deep, profound temple depression, then it's better to use the cannula together. So 1 ml for deep injection and 0.5 for superficial injection. And lastly, we'll use 3 ml for both sides. When injecting for the nose, I would recommend to observe the patient at least 1 hour after injection, because some side effects you can see not immediately after 30 minutes. So it's better to observe. And after injection, it's better to avoid too strong massage for 1 month. But Cleviel contour, maybe 2 weeks after, there will be almost no migration, even if you push the area. And hot sauna or alcohol intake, usually 1 week we should prohibit for the patients. And if patients get bruises, cool compression. And touch-up, if the patient want a touch-up procedure, I recommend usually at least 2 weeks after, because there will be a little swelling that will cause some mistake. We can do some mistake because of the swelling during 2 weeks after the first injection. So we should wait until 2 weeks, but preferably 1 month. This is my conclusion. The proposed guidelines are for reference only. So the final injection plan and decision should be made by only you. And also it should be personalized and customized for each patient. So we should listen what the patient wants also as well. And always think about how to use the least amount of the filler to produce maximum effect, because Cleviel usually can provide the same projecting effect, projecting power by using only 70% compared to other volumizing filler. And observe the dynamic movement of the patient's face, not only a static movement, static face. You should make the patient smiling or laughing to see the patient's facial movements before deciding injection. And considerations of the harmony and balance is the most important point, an essential point to achieve natural results for facial contouring. Okay, that's it for my lecture today. Thank you for listening my presentation. And I really hope this pandemic comes to an end soon so that we can meet in person. Stay safe and stay strong.